Welcome to Spotlight. My name is Belynda Lee, and I am your host. Today we have a very, very special guest. Dr. Houriya Kazim has many firsts to her credit. She is the first female Emirati surgeon in the country. She's the founder of the country's first Well Women Clinic, staffed exclusively by women for all women's healthcare needs. She's also established Brest Friends, a charity organization who includes the first breast cancer support group in Dubai. Welcome to Spotlight.
Thank you. Thank you. Lovely to be here.
It was so nice to have you on the show.
Thanks.
Now, I'm looking at all this information and introduction, and I'm blown away by your credentials. You have traveled.
Yes.
You are a local Emirati.
Yes.
And what brought you into medicine?
Oh gosh, I come from a family of doctors. I think the last time we checked about 70 in the family.
70?
Yeah, on my dad's side. My father, my grandfather on my dad's side was a hakim or a faith healer. And he had, I think, about 25 children. And pretty much all of them are in healthcare.
Oh,
and they're
wow.
married to doctors, and their children are doctors, and now the grandchildren.
Oh my goodness.
So it's one of those things where I think there is that subtle kind of psychological coercion that goes on in the family where, you know,
Absolutely
you have to be a doctor.
No peer pressure. It's
Yes,
just,
exactly. So my father was a surgeon as well. So that's part of that.
Your father, Dr. Ahmad Kazim, was one of the pioneer surgeons in the country.
He was.
Yeah.
He was the first, actually.
Not saying that he influenced you in your decision being in the medical field, but why breast cancer? Why in this area?
Well, I going into medicine wasn't a surprise because, as I said, the family is full of doctors, and I actually went to medical school wanting to do infectious diseases. I liked the idea of community health or public health. I wanted to take care of groups of people rather than an individual patient that came into the office one by one. And while I was at medical school, somebody put a scalpel in my hand, and I went, ooh, I like that. So even though
That's exciting.
It was, and even though my dad was a surgeon, he was an orthopedic surgeon, which is probably more carpentry and butchery than what I think is surgery. So I never really thought of it like that. Having said that, my mom is a fashion designer. And so everybody thinks that my sewing skills or my suturing skills come from my dad, but actually it comes from my mom. So the sense of symmetry and my kind of being able to put things together again actually comes from my mom. And so I thought about doing surgery. And at the time when I was in medical school, there wasn't such a thing as a breast surgeon. There were general surgeons who took care of the breasts. And so I thought about surgery, but at that time I'd never met a female surgeon. I think Ireland there was one, but I'd never met her. And so I thought, okay, you know, it was in the back of my head. Came back to Dubai to do my internship. I was working at Rashid Hospital, and I would see women with very advanced cases of breast cancer. Things that, you know, I just had never seen before in the hospitals where I trained in medical school. Very advanced cases. And a lot of their reasons for presenting late was the fact that they didn't want to show their breast to a male surgeon. So the sense of modesty was so strong that they would leave it to that point. And so, and I remember being an intern, being the most or the least trained person on the team, and the patient would let me examine her with the rest of the team on the other side of the curtain. And then I would have to describe what I saw to my consultant on the other side. And then he would say, you know, does it need surgery? And I would be, I don't know, I'm just an intern, I have no idea. But that sort of gave me this sort of thought, like, my God, you know, we really need to have a female surgeon. And then it was these women, unfortunately, who presented with their very late breast cancers that really pushed me. And when I went back to train as a surgeon, breast surgery was breaking away from general surgery, as many specialties
As
did.
a specialty, yes.
So that's how it happened.
Going into medicine, that takes about, 10 years?
It's longer.
It's longer than that.
That's my life.
I'm like, a long time, and
A
then
long time.
Oh, yes, it's a long time.
Yes.
And you know, it's almost like a lifelong career going into medicine. You're constantly learning new things.
Yeah. But that's the beauty of it. That's what I love, is that, you know, every day is different. And as a field, it's endlessly fascinating. You know, that you never run out of things to learn or read about. Yeah, so that's the attraction, I think, in the end.
Breast cancer is the awareness is very, very loud. It's all over the world. I
Sure.
mean, international awareness for breast cancer, everyone talks about it. They're very knowledgeable about this particular disease. And we talked before the show, is that, my goodness, awareness is so great. Compared to one of the biggest killer in a woman,
Which
of a
is not
woman's
breast
health, is
cancer.
not breast cancer.
Yes, I know. And women are very surprised to hear that.
Right.
That, you know, you're more likely to die of heart disease than you are of breast cancer. But there are a couple reasons for that. So if I tell you a little bit about the epidemiology of breast cancer, in Western Europe, in North America, the median age of diagnosis for women with breast cancer is about 62. So it's a disease of postmenopausal women. In this part of the world, meaning the whole of the Middle East, North Africa, and the Indian subcontinent, our median age is around 45, 46. So we're almost 2 decades younger. So imagine, you know, and in this part of the world, heart disease is an older person's disease. You know, when you get women in their 20s sometimes, 30s a lot of the times, and 40s, these are women that will have a young family at home to take care of. These are women that are probably building their career, climbing the ladder, and then they're hit with this disease. So it is a scary thing, and I think that's why, that's one of the reasons why I think that there's so much emotion behind breast cancer, certainly in this part of the world, is because people see it in such young people, young women.
Wow. And why do you think it's hitting the women a lot younger than
Yeah, we don't know. And, you know, I'm going to guess, because it's a regional thing, it's going to have something to do with genetics. Most cancers do have something to do with genes, but it's not just genes, it's genes plus something else. But certainly, yes, we don't know, is the answer.
Now, some of the awareness do teach the women how to detect them, how to look out for them. And can you share with the audience, have a deep dive into what they should be looking for in terms of detecting breast cancer ahead of time?
The number one pickup for breast cancer is actually mammograms, which are x-rays of the breast. And these we recommend, I mean, the rest of the world, you start at the age of 40 or 45. But remember, I just told you the median age in these countries where they start at 40 and 45 is 62. So you're trying to start screening, you know, at least a decade before, because you want to find it before the lady finds it, basically. So when it's just little tiny spots on an x-ray, as opposed to when you can feel a mass. The problem that we have here is if our median age is 45, we can't start screening in our 20s. Number one, mammograms are radiation, so we don't want to give you a lifetime of radiation. Number two, when you're 20, your breasts are so dense, the x-rays don't penetrate, so you just get a whiteout on your film, so you don't see anything. So this is one of the big issues that we have here. We don't have a very good way of screening women in this part of the world. We do try to tell women that they need to check themselves because, again, because the breast tissue is so dense, that by the time even a woman finds it, it's going to be late because the tissue is so, imagine like trying to feel something, you know, through, say, you know, dough that you're baking bread, as opposed to something that's much firmer than that. You won't feel it. So the recommendations that are international are basically checking yourself, maybe once a year having a specialist check it for you, and it doesn't have to be a breast specialist, it could be your GP, your gynecologist, and then having mammograms every 1 to 2 years from the age of 40. But as I said, we still have issues with all of that because we, you know, women in their 30s are getting cancer. They'll be under the age of mammograms, and you know, and again, by the time they check it themselves, it's too big.
It's too big or too late. Yeah. I do feel that in this part of the world, or I would say North America, because I'm very familiar with the North America region, is younger and younger women are getting breast implants.
Yes.
And as a matter of fact, there's a lot of teenagers when they hit 18, they goes, "That's my gift."
18th birthday. We used to want a car.
Now it's,
they want
I
boobs.
want new breasts. So does that have any effect with breast cancer at all?
No,
So I think it's just
no,
safe.
not at all. There was a question at one time, and not so much for cancer, but for other types of autoimmune diseases, and they've certainly looked at it. There have been several very large-scale studies that have looked specifically at breast implants and cancer. Now, there is one very rare, I'm talking about normal breast cancer. There is a rare type of cancer, which is not a breast cancer, but it occurs within the capsule that surrounds an implant when it is put into the breast. So when you put an implant in, the body reads that as something foreign and forms like an envelope around that. And there have been cases of cancer on the inside of that envelope. It's a type of lymphoma. It's not a breast cancer. It's extremely rare. Touch wood, I have never seen one. And I ask pathologists all the time here, have you gotten one? And they haven't. But it's definitely out there, but it's so rare.
It's
compared to considering how many people have breast implants.
That's true. I think in this part of the world, probably not as much.
You'd be very surprised.
Unicorn dancer.
You'd be very surprised.
I do know that a lot of my friends that has breast cancer, they use breast implants as a reconstruction of the breast.
Yes.
And so they are full again. I mean, it's very difficult for a woman not to have breasts, like you said. It's like, it's a very visual thing. It's very close to our heart.
You know, it's very personal. I think everybody's different. I have some very young patients who have removed both their breasts and have absolutely refused reconstruction.
Wow.
And you would think, you know, them being so young, they would want it. I had one, she is a semi-professional basketball player, and she was thrilled. She says, now the only thing bouncing is the ball. So she was happy. And I have lots of women who just decided, you know what, and especially if they've had their kids, they sort of, they've done their job. I don't need it.
Oh.
But then you do have definitely a significant proportion of women who their breast defines their femininity.
Yes.
It defines their persona. And I've had women, even when I do lumpectomies or just remove a lump, they will ask me how many grams I'm going to remove.
Oh, wow.
They're that attached to their breast tissue.
And so they should be.
Yes. I mean, I think so part of my job is actually gauging when I start to give options for removing a cancer, is gauging how does this woman think of her breasts. You know, you do definitely get the one who comes in and she goes, just take everything off. I don't want to know. Just take it out. And then you get the ones like, no, like how much are you actually going to take out? So I think it varies from person to person. The beauty is that we can accommodate everybody. So, for example, nowadays when we have to remove a breast in someone who doesn't want to remove a breast, we literally just remove the breast tissue. So we save the skin, we save the nipple, we literally scoop out, when I say scoop out, it's actually cut out the breast tissue, and then we fill it with all kinds of things. So we can fill it with a breast implant, as you talked about. We can fill it with tissue from your back, from your tummy, from your bum.
Oh, wow.
We can take fat and fill it. So if someone's not very big, but they still want their breast, we can literally just transfer fat from some other part of the body to the breast.
How technology has advanced.
It's great. It's really great. And a lot of times, I hate to say it, but women's breasts, sometimes after we do the surgery for their cancer, looks better than what it looked like before, because now they can go bigger, they can go smaller, they can lift, they can do And because when they look down, it's still them. They still see their skin, their nipples. Just the filling is different.
But it is so true, though, because I do have friends that has breast cancer, but they'll remove one, and they'll leave the other one. And they says, well, if God gives me one, I'll keep the one.
Yeah.
And I couldn't understand that, because it's just very lopsided, I feel.
Yes, I think from a cosmetic point of view, yes. But actually, if you think about it from a medical point of view, most of the time we're not worried about another cancer on the other side. We're more worried about cancer coming somewhere else in the body.
So are you saying that if there's cancer on one breast, it doesn't go to the other one?
It can.
It can.
You can not go to it, but you can get another cancer.
Yeah.
So if the cancer then spread to the liver or your bones or that kind of thing, that's a much more serious. That's not a curable situation.
Well, let's actually talk about that, because I think it's important for the women to know that when you have breast cancer, that's not the end. There is possibility of having cancer somewhere else too as well.
Yeah, if it spreads.
It spreads.
But hopefully...
Right. It's contained within that region. Okay. Yeah. So we talked about breast cancer and how we remove the tissue. Now, one question for you, Dr. Houriya, is that if a woman has a cancer on one breast, does it spread to the other breast?
Yes. I mean, any cancer can spread, and that's basically how cancers kill you. So you don't die because you have a lump in the breast. Right. You die because the cells from that lump spread somewhere that is important. So your liver, your bones, your brain. And you can get cancer spreading to the other side, or more likely you can get another cancer on the other side. But we don't, there are certain types of cancers, yes, that are more likely to come in both breasts at the same time. You have women that may have a genetic predisposition to breast cancer. They can get breast cancer on both sides. But the majority of the time, even, we're not worried about you getting another lump in the other breast. We are more worried about that it should not go anywhere else in the body. Right. Because as I said, that's the stuff that kills you. Right. So that's what the medical people think. Now, as a patient, as a woman, yes. What I often hear is psychologically what they think is that if I have a breast, I can get breast cancer again. So a lot of times people don't need to remove their breast, but patients will tell me just take everything off. Oh, wow. So we have several chats about it, and it's their right, but it's not something that I rush into. Obviously, we will have several conversations along the way, and then we make a final decision if that is the correct option. Well, a lot of women treat their breast as if it's their ovaries too as well. It's part of them. Yes. And women have breast and men have something else. Yes. So it's very, like you said, very personable. And exactly. It's very precious. Can you tell us more about the Wells Women's Clinic? So I found there were a couple things. One is, as I mentioned before, the whole modesty thing. And I've traveled a lot, but I myself have become very modest in my old age. I prefer going to female doctors if I can. And so I wanted to give women that option, so that taking away one barrier to their health care, that they can't say, well, I didn't go have my breast checked, or I didn't go, to a gynecologist or whatever because there wasn't a female that I felt comfortable going to. So that was one. The other thing is when I worked in a hospital here, I realized that breasts, as we were talking, is a very emotive subject, and a lump in the breast freaks every woman out, even though 9 out of 10 times that lump is not going to be cancer. But of course, every woman who gets even a pimple on her breast thinks she's going to be dying of cancer soon. So what I found were these awful waiting periods. So a woman would wait to get an appointment to see me. Then she would wait, because I would now send her to get her imaging done. So then she would wait for that appointment. And then she would wait for me to get those results. And then now she needs a biopsy. So she waits for another appointment to see me to get the biopsy. Then she's got to wait for the results of that. And then she's got to wait for another appointment to see me to go over everything. And there were these huge, long waiting times. In the meantime, the woman's freaking out the whole time. So I thought, I know I could do this better. And so that's one of the reasons I started the Well Woman Clinic, was to be, certainly from the breast point of view, to minimize the waiting, that a woman could come in with a breast lump and in 24 to 48 hours, we should be able to sit down and say, okay, this is what you have and this is what we're going to do, instead of weeks and weeks of waiting. So it was really trying to put together a more patient-centered healthcare unit, and then also have all the extra backup. So having a general practitioner, having a psychologist, having a gynecologist. And I heard that you have staffed the clinic with women. Yes, just women. And one of the reasons, and certainly for the doctors in particular, is when I started the clinic, my children were, I think, like 4 and 6. And I was really struggling to do my job as a surgeon, to run a clinic, and to be a mom to a 4 and 6-year-old. and you had to be very flexible. And I found that, schools would give you, 2 days notice that your child's going to be in some major production that, of course, mom's got to be there and I want to be there. But, a hospital, you can't just go, okay, well, I'm just going to take off for 2-3 hours and then I'll come back. So I thought, well, I figured you get to a certain stage in your life that you don't need somebody to tell you what time to get up, what time to come to work, what time to go home. If there's work to do, I'll do it. I wanted to offer other female doctors that flexibility. And so all the doctors that work for me have numbers of children, and they don't have to tell me when they come or go. They don't have a fixed time. Obviously, the more you work, the more money you earn. They like that flexibility to be able to go when they need to go, to come back, and just have flexible timings, which is, I think for us, was a very important thing at the time. My kids are grown now, I don't care so much, but at that time it was a very big deal.
Having a career woman versus a man who's, soaring in his career is totally different.
It is.
Because when a woman leaves home for a job, she's carrying with her the kids' schedule. What time am I picking this baby up? And what am I making for dinner tonight? Versus a man that leaves a home to go to work, and that's all he has in mind.
Think about
just
for the most
I'm
part.
working.
Yeah, for the most part. And I remember when the kids were young, I'd get up at 4 in the morning to put my makeup on, just so I could do it without interruption. And also it was the only time that I could just stop and it would be silent, because, I spend my whole day talking to patients, and then I come home and I talk to my kids, and it was just the only time. And to this day, I still get up at 4, even though the kids are gone. But I still get up at 4 in the morning because it's the only time that I just have that silence, a couple hours of silence, and then it's like, okay. But yes, but you have to, I think women all over the world, who work, it's the same, and you find a way to make it work for you.
You sure do.
And the guilt is always there, and you feel like you're failing at all jobs.
I say this all the time, is that when a woman have a child, it's like she removes the child from the body, but then shoved guilt into the body again.
Yeah. And it's always there.
It's always there.
Yeah.
What do you like most about your job? I hear a lot of passion when you talk about your work, your clinic, the women, your patients. Out of all that, it's work, but what do you love most?
So I had somebody ask me the other day, do you miss operating when you're away? And I had to think about it, and I thought, the surgery, the actual surgery, taking a knife and cutting into someone is a means to an end. It's what I do to help someone, get rid of this tumor. But I don't miss it. And I know that there are surgeons that literally drool when they're operating.
Oh.
I don't miss that part. I miss the patients. That's what I miss. I miss the interaction. With breast cancer, thank God it's one of those cancers that, you have your treatment, and for the majority of patients, they live a long life. And so I get to see my patients again and again, and I get to take care of their daughters because they grow up, and now they have a first-degree relative who's had breast cancer, so now I get to take care of the children. So I feel like what I do is a little bit of general practice, family medicine, because I get to know the family. It's a little bit of psychiatry, because I do a lot of talking, and obviously the surgery is there, but the part I miss is really the interaction with patients.
I want to dive into the surgery a little bit, even though it's not your favorite part.
I don't mind it. I do enjoy it, but it's not the most enjoyable.
I wouldn't like cutting to somebody else too as well. Now, from beginning to the end of the surgery, somebody's laying on your table, and to remove the tumor, how long does that process take?
So it depends. If we're doing, because we don't just remove the tumor, we also address lymph nodes under the arm. And, so if I'm just doing a lumpectomy, you're talking about an hour and a half with the lymph nodes. If I'm doing mastectomies, it's a little bit longer. If I'm doing mastectomies with reconstruction, you're looking at 4, 5, 6 hours. You don't feel the time go. You're so hyper-focused. I can't tell you how focused you are.
Now, when you do the tumor remover, you would do the reconstruction at the same time.
Yes.
And is that favorable for the patient, or to wait for it to heal and then to come back for the reconstruction again?
No, there are times where we'll do that if we think we have to give the patient a lot of radiation afterwards. But even then, even with radiation, now we try, if a patient's thinking about reconstruction, we rather do it at the same time, because that's when we can save the skin and the nipple. Whereas a lot of times we can't if we're going to leave it as a delayed procedure. So we try to do everything at the same time, which I think from a psychological point of view, I mean, obviously it's been shown for patients that is great. You have your breast removed, but you still wake up with a breast.
Now, we both know that the breast cancer awareness has been very loud around the world. Now, compared to 20 years ago, where it's just started.
I know.
How do you feel about that? Are we getting too much of it? Because everywhere I turn around is breast cancer. We have those tiny pink ribbons around. But I don't hear anything about cardiology, like heart disease. I don't hear anything about the other diseases.
Yeah, you're absolutely right.
Is it too much?
Yeah, sometimes I think it is. Because, you know, what I see in the clinic are a lot of very anxious women. And I think, you know, our job is to inform. It's not to give people anxiety, you know, and I think that's where the perspective comes in. That's where telling women that, look, it is a disease of women, but, you know, so is heart disease. And heart disease is much more important. And so when I tell women, you know, when people talk about breast awareness, I always tell people, no, I prefer body awareness.
Yes.
That a woman should get to know her body, her whole body, not just the breast. I don't like the idea of this witch hunt every month. I think you get to know what your body looks like, feels like, your entire body. And trying to get people to be more proactive about their health in general, not just the breast. And that was a really new thing here for me dealing with people. You know, the whole concept of, you know, for example, that, you know, we use, as soon as we sit in the car, we put our seatbelt on. We don't even think about it. Well, it's the same thing now. When I first came back, trying to get people to go and have a check. Don't wait until you have symptoms, right? And that's not just for the breast, that's for everything. Go and have a full check once a year, you know? And so I agree with you. I think the awareness needed to be there 20 years ago when I came, because it just was non-existent. But I do think sometimes it's too much. And I think when I see women getting anxious, then I know it's too much. I think there has to be a lot more perspective given to the public, and also pushing the idea that a woman should be taking her whole body health into consideration and not just the breast.
Good point. Very, very good point. Now, let's talk a little bit about your Brest Friends initiative.
Yes.
And how did that come about? And
yes.
why Brest Friends? I think I know why you call it Brest Friends.
Okay, I didn't call it. One of the women did named it. It's a pun. It's a little play on words. So the Brest Friends is in two parts. We have Brest Friends, a charity, and we have Brest Friends, a support group. So the charity started first, actually, probably around 2002, and it was just people, this is before insurance, before anything, and some women would just, you know, put, you know, 200 dirhams in my pocket, 20 dirhams in my pocket, and just say, you know, give it to someone who needs it, give it, you know, meaning who needs it in their treatment. And so I started collecting this money in a box, literally, to give to women. And so I thought, no, we should try to do something. At the same time, I was doing our road show where we would go around to different towns, talking about breast cancer, explaining about it, you know, examining yourself, having mammograms. And so I thought we need to put a full kind of educational program in place, and that needed funding, and then also be able to help women with education and also with paying for their cancer treatment. And obviously, as I was telling you about the age of breast cancer patients here being so much younger, actually trying to get some research in the region to find out why women are getting breast cancer so young here. So we started off, you know, mainly with the educational first, and then we branched out into helping people pay for their treatment. And then finally, in 2015, we joined with the Jalila Foundation, which is, we had the same mission, which is a trifold mission, which was for education, for treatment, and for research. And we just do the breast part of that. So that was the charity, and we do a lot of fundraising through them to help women with their treatment. As part of Brest Friends, we also started Brest Friends, a support group, and that started in 2005. And it started actually before that. I had women coming to me saying they'd heard about these support groups in other parts of the world, and they wanted to be able to talk to other women who had breast cancer. Initially, I was just putting women together one-on-one. So if I had, like a local woman who felt more comfortable speaking in Arabic, then I would put her together with a previous cancer patient who'd say completed her treatment, who could just talk to her about what it's like to have chemo, little tips about how to overcome some of the side effects, and just somebody to be able to just drop your guard with, and just be yourself. Because still we have here where people who have cancer are not that open with it. They may be open with people in their house, but I have women who don't tell their parents, and they certainly don't tell extended family and neighbors and that kind of thing. And that's fine, that's their choice, but obviously to do that, you put up a great barrier. You're not being yourself. And so that's the beauty of support groups and people in support groups, is that it gives you that opportunity to drop it and just be who you are. So we tried to start this. Initially, nobody wanted to join. I did it by questionnaire. This is in the days before WhatsApp groups and things. And I think I got 2 questionnaires back. And then I thought, okay, well, people are not interested. And then we waited a couple of years, and then we tried again. And this time we did it by telephone. And we literally, I had a nurse help me. And we just called people and we asked, is it something to be interested in? Because I think a lot of people thought this was going to be like Oprah Winfrey, that you had to like bare your soul publicly in front of everybody. And that's not what we were looking at. We were just looking at a more kind of social group. And then
support
maybe,
group.
Yes, and then maybe have some informative talks and some fun activities to go with it. So we did. We started finally in 2005. I think we had like 65 women at our first meeting. And one of the women, we chose the name, Brest Friends. So that's where that name comes from. So we've still been going strong since then. And we have just opened, so that group, we used to have a meeting once a month. We had it was in certain parts. So the first part would be a sort of a closed circle. It was run by a psychologist and a life coach. And this was for people who just wanted a little bit more care and counseling. And the next hour would be social hour, coffee and tea and mingling. And that is where the women would talk one-on-one to each other. And then we would have a program. And it could be anything from belly dancing classes to a talk about lymphedema or breast reconstruction or whatever.
How wonderful.
And then I started thinking, okay, once a month for a breast support group meeting didn't seem right, because, supposing we just had our meeting yesterday and then I meet a patient today and she needs support today. She doesn't want to wait 4 weeks for the next one. So I started a drop-in center at the Jalila Foundation, and it's for all women with any cancer. It's not just for breast cancer, where you could drop in during normal hours, 6 days a week, and we will have, we're running, this just started in October, by the way, so we have all kinds of yoga classes, Pilates classes, we have a space for that, we have talks, we have all kinds of events. And it's open anytime somebody needs to drop by for support.
It sounds like a fantastic place. Where is it located?
So the Jalila building, which is in Healthcare City. It's on the ground floor. It has its separate entrance. It's beautiful.
It's just fascinating hearing your career, your education, your career sprung into your philanthropy work. Now, for someone who's listening to you right now and goes, I'm really interested in what she's doing, but I don't want to hear all the pros. I want to hear some cons too as well. So what can you share with a female audience that's listening and goes, I want to be like Dr. Houriya, but I want to know everything, the good, bad, and the dirty.
Oh, it's funny you say that, because I do talks for young girls, and it is called The Good, Bad, and the Ugly.
Oh, there we go.
So we did the good. So I think, the main thing is, and I'm always very honest, in particular with local women, it's a long journey, a very long journey. And it's not just in medicine. I think in anything where you want to reach the top of what you do, you have to, you start climbing that ladder and you've got to stay the course. And the problem is here in particular, I think everywhere in the world for women, but here in particular, we have a lot of pressure socially to do all the other things that women are supposed to do. We have to get married and have kids mainly. And that's like, it's a big thing. And, I remember coming back from medical school, most people would go away and you'd get a 4-year degree and you'd come back and then you're ready to find your life partner and start your married life. And I remember I would be, medical school was 6 years and then I'd have all the training after that. And every time I'd come back, my old aunties would hug me and they go, "You still studying, honey?" Like, I must be so stupid. Everybody can do it in 4 years, like 10 years and you're still there. If you look at the statistics for surgeons, any surgeons who are women, they get married very late or they're not married. And as a result, they limit their family. So I got married at the ripe old age of 39. I had my first child at 41 and another one at 43. I was very lucky and blessed that I was able to do all of that. But it is a very real thing, because the older you get, the harder it is to start a family. So that was a big thing. And I think also I was very lucky because I came from a family of educated people that, if I had said to my parents that, I don't want to get married and have kids, I just want to be a doctor, I think they'd be disappointed, but they'd be okay with it because education was a big thing. If I said to them I didn't want to go to school, I just want to have babies, I think they'd be like, "What?" Everybody's not like my parents.
Yes.
And actually, it's only as an adult did I realize that I didn't have to fight those battles. I didn't have to fight the battle of wanting to go away, to go to school, to be educated. I didn't have to fight for that.
Wow.
So I think that, but there are a significant number of people here that still do. There's still people here whose families won't let them go away to study. And I was away for a long time. Who want them to get married young. And also, they have a point because I think, you get to a certain age, which is something like 24, where men think you're geriatric. So then nobody wants to marry you. So it is something to take into consideration that, okay, you love surgery and you want to be a surgeon, but you have to take into consideration, I may never get married, right?
That's true.
Which, in the West, you think, okay, yeah, whatever. But here it's a big deal, because you are going against our whole societal
Culture
makeup.
and
Absolutely, absolutely. So that's a big thing. But the other thing that, keeping it real is that it is hard. There is a reason why there are not that many surgeons and not many female surgeons. It's hard. It's a tough job physically. It's a tough job mentally. You have a lot to study. And I remember when I was doing my exams, you're working 90, 100-hour weeks and you have to come home and study to do these exams that only 10% pass each time. I think it's important that, that women know that it's a great field. I encourage, women to do it, but it's long, it's hard, and then there are all these other little things that you have to give up along the way.
But I think you've mentioned something that's so valid. It's not a matter of a career being a doctor. I think anything that you dive into,
exactly,
that you really need to focus a lot of time and energy and be really dedicated to where you want to go.
Exactly.
But you are the fourth doctor that's got consistent answers. It's like, this is long hours, girls.
It
is
is
not something of a 9 to 5 or a 10 to 6.
No, it's very
It's
long.
on call. It's day and night. You can get a call at 3 in the morning, 4 in the morning. You got to jump out and just do your work.
Yeah, exactly.
If you don't love it, you can't do that.
But I think, I see, even different fields. I mean, I look sometimes around and I think we're getting much better here. But, if you look at, all the C jobs of all the big companies here, I mean, how many of them are women? And it's the same thing that you start to climb that ladder and you're breaking off. And why are you breaking off? Because we need help. And this is why I was telling you earlier today that, when I came back and I wanted to start a family because, I get that I was old and I needed to start right away, but I also was starting my practice. And I wanted to be able to work, but I wanted to be able to work on my terms, so either flexible or part-time. And there was no such thing here. And in the medical field, it's getting a bit better, but I wouldn't say we're there yet. So I think we need to have, in particular in the government jobs, have flexibility, have a daycare center in the job place. You know, my cousin who was a doctor in the States, they actually had the daycare in the hospital. So when in her lunch break, she could go and breastfeed her baby. She could go just spend time. You know, it's not enough. Obviously, the guilt is still there, but at least you had that, you know. So I think, and this is across the board, I don't think this is just for surgeons. I think that, you know, if we want to encourage women to climb right to the top of that ladder, then we have to make way. Unfortunately, we are the ones that bear the child. We are the ones that breastfeed the child. So we have to have these things in place. And they're small things. It's not a big deal to have flexible working hours, to be able to have a daycare center. Those are tiny things.
It is, and you're right. The West seemed to adopt this rather openly. I mean, in the West, we have daycares not only just at the hospitals, but any of the corporation. Recently, we have volleyball courts, and we have, tennis courts at the workplace where they encourage people to have a work-life balance.
Exactly.
But I think for the women, like what you mentioned, when you go into the C-levels, there are lesser and lesser of it. If you do look at the American stats, 5% or less are women CEOs around all the corporate Americas. Why is that? A simple reason is that women don't get a lot of sponsors, don't get a lot of mentors that are able to go out there and help them excel into that position they should be.
Yeah.
And the purpose of this platform is to show the rest of the world, the women out there, is that anything is possible. You can't get it where you're at. You can just easily just go into a channel, look at it, and all the great women, successful women are sharing some of their skill sets, their experiences, and are able to help you get into the positions you want to be.
Well, absolutely, and I think that's important. So when you're climbing that ladder, if you look up and you can see somebody, not just a woman, but somebody who looks like you.
Yes.
So if I could see somebody who looked like me, then you know, okay, yes, I'm tired. Yes, you know, I'm working all the hours that God gives me, but I can do it because she's done it.
Yes.
And that is such a powerful message, you know. And sometimes I wonder, how did I do it? Because most of the surgeons, not most, all the surgeons when I was training were old white men, you know, and grumpy, most of them, the most part. And I remember thinking, really, I wanted to emulate these guys, you know? And now, you know, I know, for example, in my old medical school, there's a picture of me there, and it's right near to the exam hall. And young kids have said to me that, you know, they'll be waiting to go in to do their final exams, and they'll see my face, and they go, you know, if she could do it, I could do it. And I think, wow, that's neat.
That's a great motivation.
Yeah, that's so important.
It is. And, you know, you're right. I mean, we can never be like a man. We can't think like them. We can act like them. And we're our own kind. And to have a female leader stand out and be looking at to emulate, that is just so inspirational.
Thank you.
That's fantastic. Well, it seems like you have been busy all your life. How do you actually maintain a work-life balance?
Oh gosh, well,
especially
I don't even know what.
Your kids are grown up now, but when they're younger, how did you manage that?
That was very difficult. What I tried to do was, you know, when I was home, and that would be the time, my time with my girls. So we had set things. I read to them every single night. You know, we had the whole kind of ritual, the bath, the getting in bed together. And sometimes I'd still be in my suit. I'd just come home from work, but I'd jump into bed with them and we'd read together, sing songs, you know, that. So we had a little routine. And I tried to sort everything at work before I'd get home, and vice versa. When I left home to go to work, I wanted everything to be sorted. And then I go to work and do my work. But I mean, to be honest, you have to have a backup. I had a very supportive husband. I didn't have a husband that said, you need to do this, you need to have tea on the table at 6 o'clock or something like that. I had what I used to call my domestic manager, who was amazing, just amazing. She was a midwife by profession, but she was amazing at making sure that the kids were sorted. So my mind was at rest, that when I was at work, that everybody was being taken care of. And I think, you know, it does take a village. in terms of relaxing. So when I was in medical school, I used to run because it was just something that I could do anytime. I'm older now, so I walk.
Walking's great too.
But I love walking, and I love spending time on the beach. So beach is my happy place. I had to do an MRI scan yesterday, and I hate MRIs. If you've ever been in one, it's like in a tunnel with a banging noise. And all I did is I lay there, my eyes closed, and I was on a beach. And I could hear the waves. That's my happy place.
Yeah, water seems to have an effect on a lot of people.
Yes.
What are some of the red flags that women should look out for if we're detecting breast cancer?
The number one finding when a woman finds it herself, as opposed to us finding it on scanning, is a lump. A painless lump in the breast is the classic cancer. About 85% of women who come with a cancer that they found, that's what they would have come with. You can also have a bloody nipple discharge. And yes, sometimes people have pain in the breast or dimpling of the breast or some kind of discoloration, but mainly it's a painful lump or a bloody nipple discharge.
So would it be simple to say that it doesn't look like a normal breast?
No, it looks like a normal breast.
But it's got all this difference.
Yeah, you feel something. And sometimes, if you are large or if you're young and your breasts are dense, this is why, we tell people to start examining themselves from young, so they get to know, because patients come and tell me, but everything feels lumpy. And it's because your breast tissue is lumpy, but you kind of make friends with your lumps. And so you know where your lumpy bits are. And that if you felt something that wasn't there the last time you checked, well, then you know that, okay, I need to go do something. And again, I think it's important that people know that 9 out of 10 lumps that are found are not cancer.
That's right. They're cysts. Now, if someone has to go through all this ordeal to survive it all, lose a breast and all, and how would you advise this person to address the postmortem of this particular disease and surgery?
Oh, gosh. I think, what I try to talk to women about after, so once everything's finished and we have that meeting, we talk a lot about diet. The anti-breast cancer diet is actually what our diet used to be here, which is the Mediterranean diet. And again, going back to your heart disease, a recent study came out a few months ago that looked at all the different diets that we have, and the Mediterranean diet is the best for everything, for heart disease. So basically, what the Mediterranean diet is a plant-based diet with whole grains. Fish is your protein, olive oil, and a few nuts. So we talk a lot about, how to eat. We talk about exercise. Every single study on breast cancer and exercise has shown that exercise can help prevent breast cancer coming back. So we talk about what kind of exercise, and then we talk about supplements and things, because I think this whole journey of their treatment, the chemo, the radiation, the surgery, they feel like they've kind of lost control, and they want to feel empowered about their body and their health, and I think that's important. So they want to take this and they want to take that. So I just give them the information on what I think is important for their health in general. I don't think you should be taking a zillion things. I think it's important to have a good diet where most of your vitamins will come from, and then you can add or supplement according to what you need. To be honest, and obviously we do suggest about joining support groups, but the women themselves actually teach me more than I teach them, honestly. They teach me, that's why they're the ones I miss. They're so inspirational. When you see a traditional woman come into my office, with her husband the first time, where, I'll be speaking to her, but he gives me all the answers. It's kind of sad, because then you think, oh my gosh, she's got this journey and he can't do it for her. She has to do it. And the beauty of it is, you will see how strong women are, even women who don't appear so at first, because the next time she comes in, when she's finished her chemo and she marches into my office, literally marches in. It really empowers them. They inspire me, the strength that they obviously have to pull from somewhere to go through that journey. It's fascinating.
I have to close with this. It's like, what are your future plans? You've been doing so much. It's like it's never ending.
retirement.
We talked about that too. It's like, I don't think anybody can fill your shoes.
Now it's time to give back in other ways. So I am trying to do a lot more dealing with medical students and high schoolers, trying to encourage them into the field. I think it's a great field for women, and I want them to know that it is a viable field for them. So I'm doing a lot more of that, a lot more teaching.
Wow. When will you actually retire?
This is retirement.
My goodness. I was hoping to hear something like,
Lying on the beach.
probably
I'll
going
be
to
lying on the
Maldives, you know,
Yes,
for
I hope-
3 months,
I
and then
hope to
maybe
fit
to
that.
Paris for another 3 months. But it's work
Would be
for
lovely.
you too.
That would be lovely.
Wow, Dr. Houriya, so thank you so much for
No,
being on the
thank you.
show.
My pleasure.
Your knowledge is invaluable, and people who are listening, and even myself, I'm learning so much from this interview.
Thank you.
Your contribution, your knowledge, your mentorship, your inspiration, your motivation.
Oh, thank
I am so honored to be recording this so that the world can click on it and look for you and learn from you.
Thank you. Thank you. It's been my pleasure.
Thank you. Well, thank you so much for joining us at Spotlight today. Today has been just one of the most amazing interviews, and I am, how should I say, I am just so filled with knowledge, not only that, with pride for sitting here with one of the most amazing women who is a doctor, but not only that, a teacher as well. My name is Belynda Lee, and I am looking forward to seeing you on the next video.
I am Dr. Houriya Kazim, breast surgeon, and I'm being spotlighted by Belynda Lee.